Hello friends, today's topic which is also very important short note most of the time asked in the university exam viva and the MCQ उसमें viva में boundaries पूछे जाती है. So the topic is the cubital fossa. It's very important topic in your exam point of view. उसमें वाइवा में भी ग्रॉस एनाटॉमी में बहुत सारे क्वेश्चन पूछे जाते हैं. इस टॉपिक पे एमसीक्यू आते हैं. शॉर्ट नोट थियोरेटिकली बहुत इम्पॉर्टेंट है. सो लेट्स स्टार्ट अबाउट द क्यूबाइटल फोसा. क्यूबाइटल फोसा चालू करने से पहले देख लेते हैं कि ये क्या है. ह्यूमेरस उसका लोअर एंड, ये कैपिचुलम, ये ट्रोक्लिया, ये मिडिल एपिकॉन्डाइल, ये लैटरल एपिकॉन्डाइल, और यहाँ पे आता है नीचे रेडियस, और यहाँ पे आता है अल्ना. ओके, एंड दिस इज द स्किन एंड ऑल दिस टिश्यू. ओके, अब मिडिल एपिकॉन्डाइल से आता है यहाँ पे कॉमन फ्लेक्सर ओरिजिन, एंड लैटरल एपिकॉन्डाइल पे आता है कॉमन एक्सटेंसर ओरिजिन, और इसके ऊपर एक मसल ओरिजिनेट होता है दैट इज ब्रैकियोरेडियलिस. सो दिस मसल इज द ब्रैकियोरेडियलिस. कॉमन फ्लेक्सर ओरिजिन से एक मसल आता है जो ऑब्लिकली डाउनवर्ड जाता है एंड दैट इज द प्रोनेटर टेरेस. ओके, सो आई एम ड्राइंग दिस मसल. ये रहा प्रोनेटर टेरेस obliquely from the common flexor origin and supracondylar ridge on the lateral side से ये जो पूरा मसल है नीचे जा रहा है, ये ब्रैकियोरेडियलिस. ओके, और ये रही दो बॉन्ड्स, और ये मिडिल एपिकॉन्डाइल से लेके लैटरल एपिकॉन्डाइल तक ये जो है ये एक इमेजिनरी हॉरिजॉन्टल लाइन है. ओके, तो ये रहा एक पार्ट. फिर ऊपर से आता है एक मसल बाइसेप आर्म से, वो इंसर्ट हुआ है रेडियल ट्यूबरोसिटी पे. तो ये रहा बाइसेप रेडियल ट्यूबरोसिटी पे. ओके, और यहाँ पे कोरोनर प्रोसेस पे एंटीरियर सरफेस पे एक मसल आता है बाइसेप के नीचे से, तो ये वाला पूरा, तो ये रहा ब्रैकियलिस. तो ये मसल ब्रैकियलिस है, ये मसल बाइसेप. ओके, क्लियर. नाउ व्हाट इज क्यूबाइटल फोसा. सो क्यूबाइटल फोसा क्या है? इट इज़ द स्पेस विच लाइज इन द फ्रंट ऑफ द elbow joint. So it is the space which lies in the front of the elbow joint. It is a triangular in shape. Okay, base lies above and the apex lies below. That is the cubital fossa. Okay, it is homologous with popliteal fossa of lower limb. It is homologous with the popliteal fossa of the lower limb. That is the cubital fossa introduction. Then what are the boundaries of the cubital fossa? First is the base. Base is formed by the imaginary line connecting what? Middle epicondyle to lateral epicondyle. If these two epicondyles are connected by imaginary line, that forms the base which lies the above. Then lateral border and the medial border. Lateral border is formed by the brachioradialis muscle and medial border is formed by the pronator teres muscle. So lateral border is formed by the brachioradialis and medial border is formed by the pronator teres muscle. So lateral border is formed by this medial border of brachioradialis and medial border is formed by the lateral border of pronator teres, and this triangular space is called as the cubital fossa, and this is the apex formed by the joining of the lateral and medial border of the cubital fossa. So in the boundaries we have seen lateral border, medial border, base and apex. Now coming to the floor of the cubital fossa. Floor of the cubital fossa is formed by the two muscles which are inserted on the radius From the radius there is a supinator muscle, and from the ulna there is a brachialis muscle that forms the floor of the cubital fossa. So if you see the floor of the cubital fossa, ये medial and lateral epicondyle, ये radius, ये ulna. From here towards the coronal process of ulna, this muscle is the brachialis, and from behind the radial tuberosity the fibers goes like this, winds around the radius and insert over the ulna. This muscle is the supinator. So these two muscles form the floor. If you see the cross section, this is the radius, radial tuberosity, and this is the ulna. On the ulna anteriorly, this is the brachialis muscle, and from here towards the ulna the fibers goes backward, and medially this one is the supinator muscle. So this is supinator and this is the brachialis. These two muscles form the floor. Okay, so the floor of the cubital fossa is formed by these two muscles, supinator and the brachialis. Then coming to the roof of the cubital fossa, first there is a skin, then the superficial fascia, and in the deep fascia from the tendon of the brachialis there goes a aponeurosis, that is the bicipital aponeurosis, which goes downward and medially. So here lies the tendon. I'm drawing it another color, brown color. So this is the tendon of the bicep, and from this the fibers goes into the skin like this, and this is called as the bicipital aponeurosis. So superficial skin, superficial fascia, and there is a bicipital aponeurosis. So bicipital aponeurosis is the content. Now if you draw this roof, okay, so there is a, from this tendon the fibers goes like this. So this is the bicipital aponeurosis that comes along with the skin and superficial fascia. Then there is the veins. Suppose this is the lateral side and this is the medial side. From the lateral side there is vein which lies is the cephalic vein. Medial side the vein lies is the basilic vein. Cephalic vein, basilic vein, and these two veins in front of the bicipital aponeurosis connected by one vein, that is median cubital vein. Okay, and inside these two veins there lies the cutaneous nerve. This is lateral cutaneous nerve of forearm, medial cutaneous nerve of forearm. So these are the content on the roof. So skin, superficial fascia. In the deep fascia this is bicipital aponeurosis. Then there are three veins: cubital vein, laterally, basilic vein medially, and these two veins are connected by the median cubital vein. Inside these two veins there lies the two nerves: lateral cutaneous nerve of forearm, medial cutaneous nerve of forearm. So these are the contents, these are the boundaries. So हमने देखा lateral wall, medial wall, base, apex, floor, and the roof of the cubital fossa. Now the contents of the cubital fossa. What are the contents of the cubital fossa? In the contents of the cubital fossa, the contents from medial to laterally are the MPBS. M for the median nerve, B for the brachial artery, B for the tendon of bicep, and S for the superficial branch of radial nerve. So these are the content of the brachial plexus. If you want to draw the diagram of the content of the brachial plexus like this. Okay, फिर हमने यहाँ पे ब्रैकियोरेडियलिस ड्रॉ किया, यहाँ से आया प्रोनेटर टेरेस. ओके, नाउ इन द कंटेंट ऊपर से आया ये बाइसेप का टेंडन, यहाँ पे जो रेडियल ट्यूबरोसिटी पे जाएगा। ओके, फिर उसके मिडिली आएगी ब्रैकियल आर्टरी, deep artery goes deep to the pronator teres and one superficial branch. So this is the radial artery, ulnar artery, brachial artery. Okay, and then there comes the median nerve over here, which passes deep to the pronator teres or between the two heads of pronator teres, and then there lies the radial nerve which passes deep to this brachioradialis. So these are all the content of the cubital fossa. First is the median nerve. It is the medianmost content of the cubital fossa. Median nerve lies between the two heads of pronator teres and passes deep to the flexor muscle. Okay, in other words, it pierces the pronator teres. So that is the median nerve. Then there is a content called as brachial artery. Brachial artery lies in the cubital fossa at the neck of the radius. It divides into a two branch. Superficial branch is the radial artery, and the deep branch which passes below the pronator teres is the ulnar artery. That is about the brachial artery. Third is the tendon of bicep, which insert over the radial tuberosity. This tendon can be felt during the flexion and extension, and that is important landmark to identify the brachial artery, which lies medial to it. Pulsations of the brachial artery felt medial to the tendon of the bicep. Then there is the radial nerve, which is the lateralmost content. When it comes in the cubital fossa, it divides into two branches. Superficial branch passes deep to the brachioradialis, and the deeper branch pierces the supinator muscle, which lies in the floor, and passes into the posterior compartment as a posterior interosseous nerve. So these are the contents of the cubital fossa. तो हमने कंटेंट्स भी देख लिए, बाउंड्रीज भी देख लिया, इंट्रोडक्शन भी देख लिया. नाउ कमिंग टू द अप्लाइड पार्ट ऑफ द cubital fossa. So in the applied part is very important. First, vein which lies median cubital vein. The median cubital vein is used for giving IV cannula, taking blood and giving blood for that purpose, because it is the large vein, most superficial. Behind it there is a tough structure, that is a bicipital aponeurosis, which support it. Normally it does not collapse during hypovolemia. That's why this vein is commonly used for a venipuncture, to giving IV cannula, IV fluid, taking out blood, giving the blood to the patient and the persons. Okay, so that is the use of the median cubital vein, and there is no nearby nerve or travels along with this vein. That's why it commonly used. Second content, brachial artery. Brachial artery used for feeling the pulsation against the head of the radius, palpated commonly. You put your fingers up after feeling the tendon of the bicep in the cubital fossa. Put your fingers medial to the tendon of bicep. You can feel the pulsations of the brachial artery. It is also used to measure taking the blood pressure by auscultation. Put your stethoscope in the cubital fossa, and with the help of sphygmomanometer, blood pressure is felt and auscultated over the cubital fossa. Okay, that is the importance of this brachial artery. So these are the two main applied part related to the cubital fossa. So overall it is a very important short note. Most of the time it is asked as a question in the university exam, also in the viva. So mainly आपको ये याद रखना है, relations are medial to lateral in the cubital fossa. Medial most is the median nerve, then the brachial artery, then the tendon of bicep, and then the superficial branch of radial nerve. So these are the all contents which lies around in the cubital fossa. So if you like these videos, तो मेरे चैनल को लाइक, शेयर और सब्सक्राइब ज़रूर करना. इन वीडियो के माध्यम से मैं आपको जो डायग्राम कैसे ड्रॉ करनी है, आपको उस पर फोकस करना है, क्योंकि जितनी अच्छी आपकी डायग्राम लेबलिंग और क्लीन डायग्राम और अप्रोप्रिएट डायग्राम होगा, उतने ही आपको ज़्यादा अच्छी तरह से मार्क मिलेंगे. दैट्स वाई मैं रेडीमेड किसी बुक में से डायग्राम नहीं उठा रहा हूँ. मैं आपके सामने इस वीडियो के वक्त जो डायग्राम ड्रॉ कर रहा हूँ, सो दैट यू कैन अंडरस्टैंड कि आपको भी किस तरह से डायग्राम्स बनानी है, क्योंकि एनाटॉमी में बिना डायग्राम के आप पढ़ नहीं सकते। दूसरा, जितना डायग्राम्स आप याद करोगे उतनी एनाटॉमी इजी याद होगी। उसके लिए आपको डायग्राम खुद ड्रॉ करने की कोशिश करनी चाहिए, प्रैक्टिस करनी चाहिए, तभी आपकी एनाटॉमी की नॉलेज अच्छी तरह से होगी और एनाटॉमी याद भी रहेगी। दैट इज़ द मेन एम ऑफ दिस वीडियो। कंटेंट, हाउ टू राइट इन द एग्ज़ाम, हाउ टू ड्रॉ द एग्ज़ाम, एंड दिस 2 पॉइंट्स अगर आपके अच्छी तरह से क्लियर हो जाए तो आपको यूनिवर्सिटी एग्ज़ाम में अच्छा स्कोरिंग से कोई नहीं रोक सकता। और जितना आप डायग्राम ड्रॉ करोगे खुद, उतना ही आपको ज़्यादा एनाटॉमी याद रहेगा, ये आपको याद रखना है। सो अगर आप ये सारी चीज़ें आपके नॉलेज में कुछ वैल्यू ऐड कर रही है तो मेरे चैनल को लाइक, शेयर और सब्सक्राइब ज़रूर करना। थैंक यू वेरी मच।